Okay, let's be real for a second. The words brown recluse spider, yeah, they're enough to make your skin crawl, right? But a lot of that fear, it's just built on myths and some pretty wild stories. So in this explainer, we're going to cut right through all that noise. We're going to separate the scary fiction from the actual facts. We'll look at how to spot one, how to avoid a bite in the first place, and what to do if it happens. The whole point is to leave you feeling prepared, not paranoid. All right, let's dive.
So, here's the big question, the real puzzle we're going to tackle. This spider isn't aggressive. I mean, the name says it all, right? It's a recluse. It wants nothing to do with us. So, why is its bite taken so seriously? Why all the scary headlines? Well, that's exactly what we're about to break down.
All right, first things first, let's meet the spider we're actually talking about. Because honestly, knowing what you're looking for, that's half the battle right there.
So if you want to understand this spider, you just have to get one thing. Its whole strategy is hide and wait. That's it. You'll mostly find them in the central and southern parts of the US, and they're night owls. They hunt when it's dark. So what does that mean for us? Well, during the day, they're tucked away in quiet, dark spots. Think about it. That old cardboard box in the attic, the wood pile out back, even a pair of boots you haven't touched since last winter. They're not looking for a fight, not at all. They just happen to hang out in the exact places we tend to stick our hands and feet without a second thought.
Okay, listen up, because if you only remember one thing about how to ID a brown recluse, this is it. Look, tons of spiders are brown, right? But the recluse, it has this super distinct, dark, violin-shaped mark right on its back, just behind the head. It's not always huge or obvious, I'll give you that, but if you see it, that is the telltale sign. That's how you know you're looking at the real deal.
And this is so important to understand. A brown recluse bite is almost always an accident. It's not an attack. It's what happens when the spider gets trapped against your skin, like when you roll over on one in your sleep or you put on a jacket it was hiding in. It's pure self-defense, a total last resort for the spider.
Which naturally leads us to the most powerful tool we have, prevention. I mean, if the bites are accidental, then stopping them is all about making sure that accident can't happen. It just takes a few simple tweaks to our habits. Look, this isn't about turning your home into a fortress. It's just about being a little more mindful. Just think like a spider for a second. Where would you go to hide? Dark, quiet, undisturbed spots, right? So clean up that clutter in the basement or the yard. Move that wood pile away from the house. And for everything else, a quick shake. Shake out your clothes, your towels, your shoes before you put them on. It sounds so simple, and it is, but man, is it effective. Okay, but let's talk about the what-if scenario. What if, despite everything, a bite happens? This is where understanding the timeline of what comes next is absolutely critical. It's how you'll know exactly what's going on and when to get help. And here's the craziest part, and honestly, the most dangerous part. The bite itself, you might not even feel it. Seriously, maybe a tiny sting, if that. It's not like a bee sting where you know it instantly. The real trouble, the real symptoms, they don't show up for a few hours. And that's exactly why knowing what to look for later is so, so important. So let's walk through this timeline. In the first couple of hours, maybe a little sting, maybe nothing. But then between 2 and 8 hours later, that's when you'll start to feel it. Pain, burning, itching, and a little white blister might pop up. But the real giveaway, that comes later, usually within 12 to 36 hours. You get this classic pattern, a deep blue or purple center, surrounded by a whitish ring, and then a bigger red area around all of that. Some people call it a bullseye. When doctors see that, it's a huge red flag that the venom is doing its work on the tissue. And you've got to know it's not always just about the skin. The venom can trigger a reaction through your whole body. We're talking fever, chills, feeling nauseous, basically flu-like symptoms. If you start feeling sick like that after you think you might have been bitten, that is a major sign. It means your body's having a much bigger reaction, and you need to see a doctor, like right away. Okay, so you think you've been bitten. First rule, don't panic. Panic is not your friend here. What you need is a clear plan, and here are the exact steps to take, nice and calm. All right, and I cannot possibly say this enough. This is not a wait and see kind of thing. Your very first move, the most important thing you can do, is call your doctor or get to an emergency room immediately. No exceptions. This is especially true for kids and older adults because their reactions can be way more severe. Bottom line, get a professional involved right away.
Now, while you're getting medical help, there are 3 simple things you can do. First, gently wash the area with soap and water. That's to help keep infection out. Second, elevate the area. So if it's on your arm, prop it up on a pillow. And third, apply a cool compress. 10 minutes on, 10 minutes off. Both of those things, the elevation and the cold, will help with the pain and swelling. They're just simple, smart things to do until a doctor can take a look.
So what's the end game here? What does recovery actually look like? Let's talk about the reality and maybe put some of those crazy horror stories to rest.
Okay, first, let's clear up a huge misconception. A lot of people think there's a magic anti-venom shot for brown recluse bite. In the United States, there just isn't one that's widely available. So what doctors do is called supportive care. Basically, their job is to help your body heal itself. They'll manage the pain, they might give you antibiotics to prevent infection, and they just generally support you while your own immune system does the heavy lifting.
And that leads us to maybe the most important takeaway of all. The vast, vast majority of these bites heal just fine on their own with a little rest, ice, and elevation. That's the normal outcome. The really scary complications you hear about, blood disorders, kidney failure, that's the tiny, rare exception. They can happen, but they're not the norm, especially not in healthy adults. And really, the whole reason you go to the doctor right away, it's to make absolutely sure you stay on the heals just fine path. So the big picture here isn't about fear, it's about empowerment. Yeah, a brown recluse bite is serious. You have to treat it that way. But it is also incredibly manageable. And getting that professional medical help right away is the one thing, the key, that almost guarantees you end up with the most likely outcome, which is a full and complete recovery. So in the end, it really all boils down to one question. When it comes to something like a brown recluse bite, is your plan going to be based on fear, or is it going to be based on facts? Because fear, well, fear just freezes you. But facts give you a plan. And having a plan means you can trade all that anxiety for clear, simple actions. And that right there is the best protection you could ever ask for.